Well, we're here at Highlands Oncology, brand new building here in Springdale, right off Don Tyson. We're meeting with Dr. Willie Pickard. Thank you so much for talking with us today about something very important, men's health.
Thank you for having me. It is good to be back in the area.
So you're a urologist. What does that mean?
So urologist is the type of doctor and surgeon that manages everything from the kidneys, what we call the ureters, the bladder, and down to the end of where you urinate from.
So what is the function of a healthy prostate?
So the prostate is an organ that sits below the bladder, and its main purpose throughout your life is actually to provide the nutrients and support for sperm to be able to live and to do their job.
And why is it important to have a screening on your prostate?
So as you get older, there's two main problems of the prostate. The first is that it will cause problems with urination, as the tube that you urinate out of actually goes through the prostate. The second problem is that the prostate is the most common cause of a solid organ cancer in men. So about 1 in 6 men will be diagnosed with prostate cancer during their life. And we estimate that probably almost 1 in 3 men will actually have prostate cancer, but some of those men will never know it.
And screening is obviously important, and I know that you offer free screening. How do people find out if they're eligible for a free screening here at Highlands Oncology, and how do they set up a schedule for that appointment?
So anyone or any person with a willing participant is allowed to give us a call at our phone number. And we have a few simple questions, just trying to get a background of both your family history, if you have any problems with your prostate already, and then we'll schedule you for a visit. We're trying to do multiple days within the month of October. Depending on how things go, we may indefinitely continue it over the upcoming months.
Okay.
Is there a certain age that men should come get their prostate checked?
Yeah, great question.
Yeah, so the textbook definition is that all men at age 55 should consider getting their PSA screened at that time. That's a discussion that I can have with the patient, or your primary care provider can as well. If men have a family history, or if they have a history of cancer, sometimes we do change that screening to a little bit earlier than 55.
So we've talked about screenings, and something you've mentioned, a PSA. What is that?
So the PSA is a blood test looking at a type of protein that is only made by the prostate. It can be elevated for a variety of different reasons, from something as simple as just some inflammation to something like a prostate cancer. It doesn't necessarily mean you have cancer, but it's a nice way for us to think or to figure out if you're at risk for a cancer.
If a loved one is diagnosed with prostate cancer, what does the treatment plan look like?
So with prostate cancer, there are kind of multiple different varieties depending on the least severe to the more severe. The majority of men these days that are diagnosed with prostate cancer are actually observed, in a sense, meaning we continue to watch it. We checked if the cancer is evolving or changing, but we don't actively require any treatment. For the men that have the more aggressive prostate cancers, we'll talk about either a surgery or potentially radiation in order to help decrease or remove that entire risk of prostate cancer.
So I'm curious about, what if you decide not to get treatment? How do you observe the cancer if you decide not to get treatment?
So what we typically do in men that are diagnosed and not treated for prostate cancer is they're going to be watched with both their PSA, that same blood screening test, and then we're also going to potentially use a fusion between both an MRI and an ultrasound in order to ensure that we know the most about your prostate cancer. And it's a piece of technology that we at Highlands are fortunate to have, and I believe the only other spot in Arkansas is Little Rock that can offer this same advantage with prostate cancer.
Wow, that's great.
Now we know Highlands has several locations here throughout Northwest Arkansas. So we're here at the Springdale location. What are your other locations?
So right now we're seeing patients at both our location down in Fayetteville, the location here, and we're looking to start seeing patients as well up in Rogers. Right now our screening is primarily going to be based within Fayetteville, and as we see patients coming in from different areas, we may start to offer the screening at our other locations.
Well, doctor, thank you so much for your time. Thank you so much for the information and the PSA screening, the free things that you're offering here at Highlands Oncology Group. We really appreciate you, and thanks for your time.
Well, thank you for having me, and we look forward to seeing some folks at our clinic.
Yeah, absolutely. Stay with us. We've got more Good Day NWA coming up right after this.